Disasters have become all too common and far more severe than they ever have all up and down the state of California. Behavioral health has a more prominent role and needs to have a more prominent role as it relates to disasters and the way that we think about them, the way that we respond to them, the way that we prepare for them than ever before. And there's no person, no supervisor that has regretfully had as much experience, perhaps, going through a number of different disasters of all types, whether it's multiple fires, whether it's an earthquake, whether it's a shooting, a number of different events that have occurred through her tenure. Then Supervisor Diane Dillon, she is a leader within CSAC on a number of different issues. We are thrilled to have her here today to moderate this panel. Ladies and gentlemen, Supervisor Diane Dillon, Napa County.
Thank you, Graham. I enjoy working with CSAC very, very much and appreciate all that you and the staff do, especially with SB 901. Good job.
Yes.
I'm so delighted to welcome you all to Napa. I didn't have far to come today to attend this, but this subject is near and dear to my heart. As Graham says, we have unfortunately had a number of incidents, E, F, and S. Earthquake, evacuation, September 2015. At the time, I'll just put this in context, was the second largest evacuation in California's history when 1,000 people from Lake County came down to Napa one night because of their fires in September 2015. And we've gone so far beyond that just in the last few years. Major, not flooding of our Napa River, but flooding and rain-related incidents, roads closed and sliding and all of that in January 17, fire October 17, and then the shooting in March 18 at the Veterans Home, hostage taking and shooting. And it was that last event was sort of like the icing on the cake in terms of mental health issues. And so I've asked Jim to specifically talk about that when we get to him. We have two great panelists. Jim Diel from our county mental health. He's our interim mental health director for Napa County. He's the clinical director, which means he ensures we're providing quality services 24 hours a day, a 24-hour emergency response. He's a licensed therapist and has worked with children and families nearly his entire career. We're very happy that Jim is with us here in Napa County. And our second speaker will be Alena. Alena lives in Santa Rosa and is the North Bay Regional Community Benefit Manager for Kaiser Permanente, serving Marin, Sonoma, and Napa Solano areas by directing grant programs and assisting with community health needs assessments. She previously served as Executive Director for the Center for Wellbeing, a healthcare nonprofit committed to defeating chronic disease in the North Bay, and the City of Berkeley Health and Human Services Department. So we're grateful you could join us today. We're going to start with Jim, and then Alena has a presentation as well, and then we'll be happy to take questions. This, again, I can't emphasize enough how dealing with the mental health aspects of disasters is a really important topic for us all to have a better understanding of.
So we've been hearing a lot today about really important things, right? Realignment, funding streams, beneficiary rights and access. The stuff that I want to talk about today doesn't have anything to do with any of that. It's Medi-Cal eligibility doesn't matter. In a disaster response, it doesn't matter. Medical necessity is not a thing. I don't care if you're mild to moderate or severely mentally ill. I don't care what your zip code is if you're here and you're impacted by a disaster. This is about a local government response to tragedy that hits it. And we learned a lot of stuff. So it's not just, this isn't about feeling sad about it, or this is about, we've learned things that I think are valuable to people. And county governments form a key function. We're built into the ICS system for the state and the federal government for a reason. So that's kind of the value I think that we bring to this is we've done this. As Supervisor Dillon said, and I got to give a shout out to our CEO and our board, have been exemplary through these disasters. So hats off to them. We've restructured in multiple ways. We've got lessons learned. We eliminated our DOC and rolled everything into an emergency operations center. We learned about vicarious trauma. We learned that appointments and clinic operations don't matter during a disaster. Scheduling an appointment for next Tuesday isn't really what folks are looking for after their home is burned. And that we have to pivot in like 90 minutes when we're deployed and go from a chronic disease management, insurance-oriented treatment engagement model to a population health, trauma-focused, community-wide crisis response that meets everybody's needs wherever they're at in a community-facing, front-forward way. And we did that through a bunch of different elements that, we're happy to share. It's one of the beauties of county government. We're not proprietary about these things.
So, hello everyone. So my name is Alena Wall, and I'm with Kaiser Permanente, as you know. And I am a native to Sonoma County, and the fires burned within a mile of my house. I had a family friend that perished in the fire in Sonoma County. I had a patient for the healthcare organization that I worked with before joining Kaiser that perished in the fire. And I've been with Kaiser Permanente for 6 months now, so I was not with Kaiser during the evacuation, which I'm proud to say we were able to reopen the hospital within 17 days, which I think is just incredible. But I've been put on the fire recovery project because of my deep understanding of the need, and because fire recovery actually wraps under our community health vision from a national, regional, and local perspective. And so I just wanted to say it's heavy to watch the video and to watch the slides. It brings up a lot for me personally, just as a resident that went through it. But I'm proud that we're here. It's a year later, and we're coming out on the other side, and we have these opportunities to collaborate and, from a Kaiser Permanente perspective, to really do some deep investments in the community. And so far, we've invested around $7 million, and we're just ramping up. So I hopefully will, this is my first presentation externally in my new role, so hopefully I'll be able to meet your needs today.
So I think I agree. I think focusing on where we're at in recovery is a big thing. I think we should spend a lot of time talking about that. Recovery is important. I think it's hard to think about disaster response. It's not pleasant. We've all got trauma from it. Watching the maps and thinking about my family, watching people come out of the EOC because our staff lost their home in the middle of the event, that was difficult. That left a mark on folks, myself included. I think it's important to think about because the research shows you got a window after that to make the changes that you're going to make. And we're in that right now. So there's an opportunity for folks to adopt best practices, move forward, integrate care, to piggyback on what Karen and the group would partner, collaborate. That's why we're up here, and really kind of build better responses. Because as difficult as it to think about, we've been activated for fire response 3 times since July. This is not something that appears to be going away anytime soon. We've had earthquakes, we've had floods, we've had mass casualty incidents. 15 of the 18 FEMA events have impacted small counties in the last 10 years. These things continue to occur, and so being prepared seems like a good idea.
So, Jim, maybe you could talk about how we have engaged with Mentis, a local nonprofit, and with COAD.
Oh, yeah.
Because I think that was something we learned. We didn't have those engagements for the first 2, for the earthquake and the evacuation. But by the time we got to the fires, we had a whole system in place that really, really helped us do a much better job.
Definitely. So, so when you transition from disaster response to recovery, roles change, and you go from this hierarchical, mission-oriented critical incident response to a collaborative community response where the partnerships really take on a different role. You can go into that. Let's have a discussion on how we're going to jointly design this, how we're going to work together. it's not really recommended you do that in the middle of the disaster. It's kind of a joke. So we've implemented things like we meet every other month with all the executive directors from our nonprofit association, including Mentis, who really stepped up in a major way in our recovery efforts.
Maybe you can describe what Mentis is.
Mentis, formerly Family Services of the Napa Valley, is, I believe, the second oldest nonprofit, if I'm remembering Rob's pitch. They're a great community partner. I've been here 50 years at least. Have historically provided services to underserved and vulnerable populations, mental health housing, family and children. They serve the whole age range from birth to the other end. They're one of those kind of core mission-oriented nonprofits that you have, and some communities are lucky enough to have. They took on you need a nonprofit to be the delivery agent for CCP grants, which are awarded by SAMHSA during federal disasters. They raised their hand when we asked them, hey, would you do this? And so what they do is they go out and they train community groups to do their own process groups. They do outreach to targeted areas. We use that GIS mapping and our shelter data to figure out where they needed to go, and we were able to deploy based on language needs as well from shelter data. So we could do these groups would spring up. They would train people to operate them themselves, and then they would pull back and go set up another group. This creates that below diagnostic, below insurance level that doesn't normally exist in county infrastructures and really is key. And then they plugged into us very nicely because we already worked with them. We also have been working on other things like enhanced community messaging around disasters, because when we see ash falling on our cars now, we have different emotional responses. Those kinds of things we've been rolling out. We've currently got them written up for fire, flood, pandemic, earthquake, mass casualty event, all the bad things we don't want to hear about. You make a lot of agreements when you're not in a disaster about what happens next time and how we meet people's needs. And we've worked together collaboratively around really coordinating care for anybody. We've done 24/7 call access, countywide response. We just extended our county obligation for 24/7 response to include anybody who indicates a fire or disaster or the shooting. We responded to them through Mentis, through our other partners. We're coordinating with Ole Health on this, and it's been an opportunity to really work closely together.
And I'm going to I can see you have a lot to contribute to, Alena, but just, I think one of the things we learned from the evacuation was what Red Cross could do and couldn't do. Mm-hmm. And that was September 2015. That was a big learning experience for us. And so we determined that we were not going to have a repeat of that. And we entered into contractual arrangements prospectively with key identified, vetted community organizations, so we wouldn't have a competition at the last minute for those services or political decisions being made about who should be providing services, and had that ready to go. And that's the COAD group. Mm-hmm. Community organizations active in disasters. And so when Jim mentioned that we were engaged with them in the non-disaster time, it's not unlike the county preparation that we all do in-house. We prepare with our nonprofits because we need them at that moment to spring into action, and it served us so well with the fire situation.
I neglected to mention, that reminds me, the COAD, who is having their disaster conference right now, is where I'm going after this. They've been really useful in helping organize our nonprofits in exactly the way that you're describing. And that was one of the things from the evacuation. That wasn't the case, and it was very difficult. And now it went off without a hitch. They've really stepped into that role beautifully.
Okay, so Alena.
Would I like to add?
Yeah.
I think just real quick, I wanted to add that we deployed early funding, so to the Red Cross immediately, and also funded Mentis and CHI Napa. for the very reason that was just described, of really making sure that our most vulnerable residents were being linked into services, and that we weren't overlooking the needs of the community. The other area that we've really done a lot of investment in is with the Sonoma County Health Services. We gave $1 million to their HOPE Crisis Intervention Program. And I'm sharing that partly to just demonstrate where Kaiser likes to lift up interventions that are working, and also to help you think about ways that we could partner with you when you hear about these types of investments and how they're focused on community health and our most vulnerable.
After the incident we had at the Veterans Home, where a troubled veteran, yes, a soldier, took 3 women at a Pathway Home was a nonprofit that was established to help folks with really severe PTSD. And one of their clients took 3 of the clinical workers hostage and then killed them. And my worst day as a supervisor, I can tell you without a doubt, March 9th. But the parts about that complicate the situation were that it was at and so I want Jim to expand on what you're supposed to do in his profession. It was at a location of where we have the largest veterans home in the United States, is in Yountville. Over 800 veterans live there. They take their meals in a dining room. This incident happened at 11 a.m., so now they're locked down in their rooms. How do you get the medication? How do you, and all the employees are locked down. There's a major auditorium there, community center, and kids from the local high school were in the auditorium rehearsing for it was sort of like a disaster drill one might invent for how are we going to deal with this. And it was in Yountville. It is a very small community, and the Veterans Home is technically in the town of Yountville. And so if Jim could just touch on what happened that day and what happened afterwards. And also, I think what's important is how you dealt with the fact that it had only been 6 months since the fires. Our county staff is just stretched to the max, and how you dealt with that aspect of it too.
So when you were talking about the staff trauma, so half of our management team, our supervisory team in county mental health was either evacuated or lost their home during the fire. Good chunk of our staff as well. They were then redeployed in March around the shooting event up at the Veterans Home. So day of the event, we responded to the 60 students from the center, made sure that brief interventions, therapy, and triaging to more robust services if needed was provided to all of them. We coordinated with the VA right during the event, but after the event was really where the recovery aspect of it kicked in. So we did what you do in a disaster or critical incident response, and we deployed and we provided the treatment. But then subsequent to that, people were really showing the where. They were still coming in. We're disaster response workers. We do that, but they were looking frayed. So we coordinated with UCLA. Chip Schreiber is an epidemiologist that works there in disaster response. He's responded to the shooting in Las Vegas. He's responded to Sandy Hook, other major events. He helped link us up with folks to debrief and provide support to our staff. So we're doing some vicarious trauma support for them. We also are building a peer support program, which we're actually, our HHSA director who works in probation has a peer support program there that we're looking to emulate in mental health, so that our staff who are responding to this, they're human, they begin to have reactions after months of this. And so we focused on offering support for them, not just our EAP and healthcare resources, but really building it into our system so that we're doing debriefs, we're talking about how people are doing, we're making folks responsible for one another, if you see your colleague is struggling, talk to them about getting assistance. And then we really we brought in the National Trauma Center to train our staff in that collective support, and we did that in collaboration with Sonoma County.
And so anytime we're talking about any of these events that, well, especially with the fires, I always say to folks, yes, we had a tough time in October, but it was 10 times worse in Sonoma County. 200, as many of us know, and you reflected in the video, 200 hospital personnel lost their homes among the 5,000 homes that were lost. So how are what we've described as sort of a mini version? What's been happening in Sonoma, and what could folks here learn from how you've all learned to do things there?
Yeah, thank you. So in Sonoma County, 5,300 homes were lost, and 40% of those were low income, and pre-fire, only 1%. We had 1% rent availability. So we have a major housing crisis in Sonoma County, in addition to the mental health impacts, which I'd like to hopefully have time to talk about both of those today and kind of what our strategy is to address that. I can say internally at Kaiser Permanente, we have every other week, we have these drop-in group sessions. They're using the Swartz rounds model, which is an evidence-based model to support direct service providers when they're interfacing with clients who have really heavy emotional stuff that they're dealing with. So, and then of course we've activated our EAP and all the normal things that you would expect an employer to do. But I do think internally Kaiser's really gone above and beyond for their own employees to make sure that you can't take care of anyone else if you're not taking care of yourself. So they've done a really good job, or we've done a really good job of making the employee a priority. And then from a community standpoint, one of the models that's emerged, there's a lot of coalitions that have come together. Some have wrapped under the Health Action Council. I don't know if you guys have followed the work of Health Action, because Sonoma County is a CACHI site, an accountable community of health site, so that probably is relevant for many of you. And so through Health Action, which is there's 47 kind of cross-functional leaders that are appointed by the Board of Supervisors that are to drive change and make the community the healthiest community possible. There's a whole subcommittee focused on mental health. And one of the initiatives that's been endorsed by Health Action and is being supported by Kaiser Permanente is the Resilience Initiative. And that's the Center for Mind-Body Medicine's evidence-based model. They came in after Katrina. They've done things all over the world around really fostering hope. And one of the things that they found in their research is that residents need to have that resilience pre-disaster and that community connectedness. And so this is really a long view for us from a community health standpoint. There's the immediate disaster response, and that's like the Red Cross and supporting the shelters, deploying staff to shelters, which we did. But then this long view is really looking at housing and community resilience and how do we wrap support services around our undocumented community, our immigrant community? Another thing that we've seen both in Sonoma and Napa County is that our most vulnerable residents, many of the undocumented or immigrant residents, were having a lot of fear around even seeking services. So lifting up nonprofit organizations that are that trusted resource. So CHI Napa is an example of one of the nonprofits that we invested in and are continuing to invest in. And so for the recovery strategy for Kaiser Permanente, this is a 5 to 7 year project through program office and regional. And then if time permits later, I'd like to talk a little bit about our housing and health initiative.
I think, again, that what you all, if I were sitting out there, what I'd want to hear is what can I take away? What lessons have I learned? What can I take back home? And so I would hope that your questions could generate that kind of information from us if we haven't already. So do folks have questions? We're kind of free-for-alling it here a little bit, but we're a small group.
We've had a wonderful session today. and it's been about behavioral health. Didn't know about this sort of situation with the Redwood Complex, which was the same that all of you went through last October. But with the Mendocino Complex this time, the river and the ranch, we received a lot of people from Lake County as well, because Highway 20 was being closed down, people were being evacuated. But there's one population of certain people that you're not going to get in your shelter, that you're going to have to find out where they are and where they went. The population, this is the population that are on drugs and alcohol, and they don't go to shelters. They ended up at our recreational campgrounds at the lake, and a lot of havoc. But it's just something I want to put in your mind, because first time around, last October, didn't think about that. This time around, it was pretty frightening for campers, families, to even take part in the recreation at the lake. But they were certainly some people that needed to be supervised and, certainly needed a place to go. But I just wanted to leave that little idea in your head that all of us working with individuals like that, you got to go find where they are, because they otherwise will be creating havoc without the help.
I think that's a really well-taken point. I didn't talk about our community outreach targeting those things. That happened here. We found out through Facebook during the Lake County evacuation that one of the ranches up in the hills had a similar thing occurring, and we did outreach. So I definitely agree that there's going to be groups that may not want to enter your shelter, and you have to have a plan for that. Our members of our community who had concerns about documentation status had very serious concerns about registering, especially when folks are pretty sophisticated. FEMA, the branch of government that FEMA is part of, is Department of Homeland Security, and they have another department that group is not really looking to come across, and the documentation you sign indicates they will share that information. So folks were not registering. We were doing outreach into that community. We had hundreds of people that were hesitant to access the shelter, so definitely have a plan for that.
We had the fires in 2007 and then the fires again in 2018. And in 2018, the staff, it was like just, clockwork. They just jumped right in. They were like experts, right? And they weren't, but they were much more expert than they were in 2017. But the one thing that I worried about as the CEO was that, and I'm sure every county can say this, you have those key people that jump in. They will always jump in. They will always be there. They will always go the extra mile. And I worried about the staff, and I worried about my staff just being so stretched, so burnt out, so tired, and they just kept going. And so what would you say as far as the leadership and how you really, you try to give people days off, you try to tell them go home with your family, but then you're still calling them at 10 o'clock at night. There's still all of that. And so this is really for Jim as to what are your thoughts? What would you say? Because we're really talking long term. We're in recovery from 2018. We're in recovery from 2017. And we're not even at October 1 yet of this year. So, what would you say as far as the long term? Because we're probably looking at a few years ahead of us of still having some key issues.
So I think that's another really good question. So we're doing things in an effort to counter that, but to be honest, we're in uncharted territory with the number of disasters we're having and the frequency. I've never heard of counties having 3 to 5 disasters in 5-year spans and then ongoing activations. So yeah, the long-term impact on staff is a question I think we all struggle with. With that said, I think as leadership, what we've done and our leaders have encouraged is we look out for the staff, we monitor one another. We're using a tool, the SciStart aggregated worksheet to triage trauma response. There's a provider version of it we're looking at as well that lets you monitor your staff for how they're doing. Symptoms are a really poor predictor of trauma reaction in a disaster. That's like a pretty technical thing. I've been avoiding that, but saying, oh, this person's having sleepless, it doesn't necessarily tell you you're going to have post-traumatic stress disorder. It's event exposure that you're monitoring. And so when people have high frequencies of event exposure, it wears down providers. And that's really what you start to focus on. What have individual staff experienced? If you've got staff that, came across a dead body, had an evacuation, were threatened by another client later in the year, this is not hypothetical. I'm describing something that, then you start to worry about them. And then you do active engagement with them. You make sure that you work with them. Try not to freak them out by having the director come and talk to them directly, but you have somebody like their supervisor, someone with a relationship that can engage with them, help them make use of the resources that we've put in place and our board has provided us.
This is Farah, and I just wanted to interject. We were supposed to have a third panelist today, Todd Metcalf, the Behavioral Health Director in Lake County. And you've heard several references to Lake County throughout the day. They've had 6 major fires in 5 years, which have required at least half of their county to evacuate each year. And Todd was going to be on this panel, but surprisingly, they had an emergency back in Lake County, so he wasn't able to be with us today. But he also wanted me to communicate that the impact on staff is significant. And even with the ranch fire recently, his department, mental health department, had a report due to DHCS. And if they didn't get this report in, DHCS was going to keep 25% of their realignment revenues. So they were working to get this report done. The fire erupts, and where the county staff that was working on the report was evacuated for 9 days. And so, 2 days into that, I had a conversation with them. We called DHCS and said, look, it's an emergency situation. You've got to extend the deadline. And they did, thankfully. But it's even things like that, where the day-to-day work of your department and your county and your facility gets interrupted, and how you get back on track with that sort of thing. And I think that Alena and both Jim, you talked about in the video, Alena's video showed how having other staff come in. I know Kaiser had staff come from the greater Bay Area. Jim, did you have other counties or sort of a mutual aid sort of situation at all? Or
that was a wonderful, slow pitch to me. Yes, thank you. So mutual assistance is your friend as a county. We got support from many of the counties in this room during the disaster, even afterward. I'm going to forget people, but off the top of my head, San Francisco, Humboldt, Marin, Solano, Contra Costa, San Mateo. I encountered staff from all those counties working the shelters. We put a staff member in every school that reopened after the fires. That was an incredibly helpful experience. And the other thing I was considering when you were talking was you mentioned our partners at the state, who I received 2 phone calls from DHCS during disaster operations. One to ensure that we were in compliance with our contract obligations during the fire. So I had a reaction to that, and the second question was just to let us know that we could start writing a grant proposal for CCP during the fire. So it would be great to get. I thought Cal OES was really strong. I thought a lot of other state departments were really excellent. I would like to see a more leaning forward response from our partners in DHCS on that.
I was just going to comment quickly about when we talk about the rebuild in Sonoma County. As I mentioned, we had significant housing loss. And so one of the things that we've been staying actively involved in is looking at how do we support the city in expediting the rebuild. And the latest conversation we had was about the general plan. So it's time for the city to do a new general plan, and then they have to have a specific plan related to addressing our now housing crisis. We actually had a housing crisis yesterday, and now it's just magnified. But that's actually something that Kaiser Permanente can assist with investing in. And so we're staying very close to that. We have a housing and health initiative. I'm sure you guys saw the press around that there's the $200 million in impact investing that's rolling out. But separate from that, we also do pre-development investments. And so on my drive here, I got notice that our grant to Burbank Housing for $1.6 million was approved by our board of directors, which is really exciting. And that will bring 160 low-income units to rebuild specifically that Journey's End mobile home park. And that was the property right next to Kaiser Permanente. If you've been following the press at all, there was the row of mobile homes that they saved, and the rest burned. One resident perished in that fire. And so just it feels exciting that we're making progress in that and that we're able to invest in that pre-development. We have another housing grant that our board will be reviewing at the November meeting, and that is specific for low-income senior housing. So stay tuned, more to come with that.
Before we leave the topic of our employees, my CEO has the mic, and I think I would ask him to address some of the, we're not private business. We can't give people bonuses, but they certainly need a lot of recognition, and especially when you have employees who lose their homes or suffer themselves or have family and relatives who do. And also how you avoid workers' comp claims. So.
Thank you, Supervisor. I'm Interim, I'm Napa County CEO. Yes, it is a difficult time for all of us, and I feel that after each disaster, it's almost like during the disaster, you are trying to do a 100-meter mad dash. And we finished those 100-meter dashes, but when we finished the dash, you started a marathon. And we are in the middle of marathons, several of them, in fact. And it is difficult. And during the disaster times, thanks to the leadership of the Board of Supervisors, the board recognized the commitment and the dedication of the staff, and authorized me to allow the department heads to allow flexibility in terms of work schedule, in terms of the ability to report to work or work at home, taking extra 1 or 2 days off during the disaster. That helped a big time, mainly because of these type of interactions and recognition. We were very fortunate because I know that many entities, including the cities within Napa County, there were many workers' comp claims that came in from staff. But for us, Napa County, I'm very proud to say that we have 0 claim of workers' comp come in. That is super important. And then on top of that, yes, we cannot give bonuses or promotion or what have you. It is difficult. But however, we do a lot of staff recognition. In fact, for example, the upcoming Board of Supervisor meeting, which is the anniversary of the fire, October 9th, the board have dedicated the entire board meeting to basically go through everything related to emergency preparedness. The board will talk about lessons learned, talk about the financial recovery, but certainly a big part of that is staff recognition. And so I feel that I'm very fortunate, we are very fortunate in having a workforce that are very committed. I think it has been a tradition and a culture of Napa County. So in that sense, it's difficult to train for or to do it, but it's over time. So I would encourage that, looking at that, because every county staff is sort of a first responder. And so if you are able to get into that culture and the recognition, the need. For example, several of our staff members lost their homes, and everybody came together. And we dedicated, in fact, this last recent fire up in Berryessa, 2 county employees lost their homes, and the county staff came together, donated their times, and they got about $30,000 donation for that. So that, again, it's just a family environment.
Yeah, I would say that I started serving on a committee at ABAG about 10 years ago. That was resilience for earthquakes. And the main message from that is we, who are all public servants, we can't help the public if we don't have our own ducks in a row in terms of our staff and how to help them. After the earthquake, which happened in the early hours on a Sunday morning, and we had, 600 employees who couldn't go back to their desk because the desk was covered with debris or waterlogged or whatever. We had fortunately happened to buy a new building 8 months before that we were planning to move to. But it was really important to we had everybody at a desk by Tuesday at noon, because, and with a laptop or some sort of computer, so that they wouldn't lose pay, because we weren't authorized to pay them if we were able to declare an emergency and say, sorry, you all have to stay, or stay home without pay. But it was really important to be supportive to them, and we heard from them afterwards that they appreciated that effort. I mean, we were in a lucky spot that we were able to do that for everyone. But it's just a factor. It's one of the things you have to factor into helping the public, is helping your employees first.
And as one of your staff, I think it's really recognized among the workforce. We really see the board and the CEO recognizes the strain on us, and it really helps just having that environment of feeling connected. And during the disasters, you guys were in it with us. We saw you walking around and engaging with people and helping us with the work. It really fostered a team mentality and strengthened our morale, I think. It's true. It really makes a difference. And I hear people comment about it.
So hi, Monica from Solano. So my concern is down the road. So what are you looking at in 5 or 10 years? For example, anytime I think that there's smoke, I send my son outside to look. And the earthquake, because I'm on the Green Valley Fault, anytime we think that there's just the window is moving a little bit, I think we're getting that earthquake, because that woke us up at 3:45 in the morning. So the question that I have is, what have you worked on, and what can we take back so that we talk with our folks, as not only just our constituents but our workers, so 5 years from now when something clicks, they can get the help that they need, because it might take that long. So what have you thought about, or what have you worked on?
So you can't over-prepare for these events. The more practice you get, the better you'll be at it. We do annual drills related to disasters through our regional. You guys are part of it and participated in it as well. They do what they call injections, where they tell you during the event something's different now. The Solano County staff who are going to report to the EOC were all told that they were impacted, find new staff about half an hour before they were to report. Well, that'll be fun. And they did. So those are the types of things that occur in terms of preparation. You build in a regular routine. You develop a disaster response plan for all your departments. You want hard copies of that. It sounds kind of antiquated, but if your power's out and your laptop dies, you really want to be able to access your plan. Things like that. Everybody should have a behavioral health disaster response plan. We've got one in final draft. Other counties are developing them. And then work with your public health emergency preparedness officer, because that's all counties have one.
Preparation is the key. And I just will say, I'm carrying my hard copy around of county employees and their cell phone numbers. And I almost always carry a battery backup for my cell phone. I mean, it's just, that's what I'm going to do to be able to be more responsive than I was October 8th and 9th, when I had no electricity and
So that's becoming your new norm.
That's my new norm.
Yeah.
And the other new norm, everybody's spooked right now, at least in Napa. I don't know about where you all live, but we've been on red alert twice in the last 2 weeks. We are, the large part of the county that I represent is in the Tier 3 fire threat area as identified by CAL FIRE. And my constituents are spooked that when they smell smoke or think they smell smoke. But I've come to believe that you're a little less spooked if you know you're prepared. So for instance, everyone in this room has a spare pair of glasses and a flashlight taped underneath their bed, right? You better, because when the earthquake happens, it flies across the room and you won't be able to find it, and you have a pair of shoes because you're going to be walking through broken glass. So you all have that. But we need every one of our citizens to have that, because we don't have the ability to respond to everybody who has cut their feet walking across the glass. I mean, that's part of what we need to do too. Everybody has a go bag, and everybody has a grab list. What are you going to take if you have 5 minutes? And so I've become kind of, people are tired of hearing it, I think, from me about this, but I'm going to keep saying it until I know my community is as well prepared as they can be, because that is going to help us respond for them. And that a big part of our job is helping them, just reiterating how important that is and how it will help them. And I have seen it where we've done this, and we're working neighborhood, in taking something like Neighborhood Watch, but making it be neighborhood support. Do you have, is your elderly neighbor, who's going to go help? The people that many people, for a variety of reasons, lost their lives in Sonoma County of different ages. The people who died in October in our fires were all elderly folks and one care provider. And so we can all help each other and need to be better organized. And that takes more people within our county staff. But I think it pays back tenfold.
Yeah, just to add to that, and it's the partnerships that it takes. I think in Sonoma County, there have been a big push to have block captains in all the neighborhoods, and have like the disaster in the garbage cans, like the disaster preparedness kits in a garbage can for the block captain in each area. And then the city of Santa Rosa has a community engagement lead that has been going out and doing education for block captains and really trying to activate the community. That's the opportunity. That's kind of the silver lining of when you've had a really tragic disaster in your community, that people will listen and be activated in a way that they maybe wouldn't have been before. And so we're really trying to think of ways to strengthen those collaboratives and leverage the activation that we have right now.
Just wanted to mimic what was already said. Butte County actually activated 5 times in 2017, fires and the spillway event, and we had no network connectivity, we had no phones, everything was down, and so all the best planning in our EOC went out the window, and we were living on our cell phones trying to read documents. So paper, not high tech. I've told my staff, technology is wonderful till it's not there, so we have to have a backup plan. And what we ran into is depth. Fairly small county, the same people worked the EOC 5 times in 1 year, and then had to do recovery, and we had recovery from 3 fires. And those same people are still doing recovery from 1.5 years ago. And so we really noticed the 5th activation, we looked at each other and said, I didn't get an adrenaline rush when my phone rang at 3 in the morning. Something's wrong here. So we pulled in EAP, and we realized, just the EOC folks, we weren't having a kind of normal reaction to the event. So we are doing depth. The same people cannot always be in the EOC, and they can't do recovery also. So really, with your employees, you never can have enough people in one of those positions ready to go. So thank you.
I totally agree with that. And one of the big takeaways for us is when we ask for mutual assistance, we didn't ask it for our leaders. And we do that now.
I have a question. One of the lessons that we learned, particularly during the Oroville Dam evacuation, was a plan for conservatees, a multi-agency plan for our conservatees. We were scrambling at, trying to find the lists, et cetera. What lessons, if any, did you learn in terms of a coordinated response to get those individuals to safety?
So that's me again. Dorian, that would be, are you talking about specifically to that? Because we had folks that were impacted in that area. Right. Yeah, for that one, yeah, for the Oroville Dam incident, we were involved in that multi-agency element. You're in our neck of the woods. I didn't really talk, this is like a whole other section, but like during the fires, we checked on every client we had. That was one of the things. We have a call down list that we go through for our regular folks, including that. We looked at all impacted facilities. We checked in with all of our contractors. I didn't mention it, and I should have. It's one of the things we do. We're responsible for them. So we checked on all of them. We arranged for short-term contracts with skilled nursing facilities and enhanced board and cares to transfer people out of areas needed. We coordinated with other departments. All of that is built into our plan. We also checked on all of our staff, which is one of the things that I'm sure folks are thinking of, but we assigned continuity of operations staff to work the list, and with the sporadic cell numbers, sometimes that meant going and checking on someone.
I hope that we met some of your expectations today with this discussion because we morphed a little bit. It's taking care of people's mental health is a really challenging task, especially these days, and so everything that we can share with each other of lessons learned is valuable to each of us. So I really applaud CSAC. Behavioral health is not a sexy topic, but it's a really, really important one for all of us who are in county world, and we know that. So I applaud CSAC for allowing us the opportunity to get together today. And I think a really important thing for us to do is to continue to communicate with each other on best practices, on lessons learned. Hopefully everyone will not go through as much as all the other folks in this room, everyone else in this room. We won't all have this same experience. We just can't. And but we can help each other. And so I want to thank Alena and Jim for their participation today. And please let's continue to communicate on this issue.
Yes,
Thank
let's
you.
give them all a big hand. And that goes for you too, Supervisor Dillon. Thank you very much. I wanted to thank all of you for engaging with us today, for coming and participating. As Supervisor Dillon indicated, behavioral health is not a sexy issue, but it is damn critical in terms of making progress in our communities, and it's more relevant today than it ever has been. So there's such great opportunity in terms of counties leading, making change into the future, and we're in the middle of it. So this is the beginning of what'll be probably a long journey of learning and building together in terms of innovative ways to integrate behavioral health into other service sectors, ways to bring in criminal justice to the conversation, ways to make improvements on homelessness, ways to partner with those folks that are in the community. And so thank you for your engagement. And I'm sure you all have a number of other ideas that we need to think about related to behavioral health. So reach out to us. This is the year in which we are building our legislative platform at CSAC. And so if there are key policy areas that we need to work with the state on or work with the feds on that are in the behavioral health area, we want to hear from you so that we can go and be the best advocate in the country on behalf of counties. So thank you all very much. Have a fantastic afternoon.